Welcome to Conversations with Catt, the podcast where guests share their remarkable stories of transformation and the incredible paths which led them there. Today's guest is my doctor. Dr. Carolyn Hefner was trained and practiced in Western medicine for many years, but her personal experience with fibromyalgia is what turned her to seek alternative medicine. That worked so well for her that she opened the Ozark Herbalist to help others. In this time of people being especially focused on their health, I wanted to share Dr. Hefner with you. I am here, my guest today is Dr. Carolyn Hefner, and I was trying to think, has it been almost 2 years that I've been coming to see you?
Probably.
I was thinking it's been at least that long.
Mm-hmm. And you look good, by the way.
Thank you. I feel wonderful. I'm feeling great. Good. That's the thing is so many people have asked me, and we'll get into this a little bit, but you know, I've seen it at my age. I just turned 55, and I take so few medications for anything. I just said to someone just the other day, I had a really bad headache, and what surprised me was I haven't had a headache in years, so I knew, and they said, how do you not have headaches? And I said, well, I don't know how to explain it, but I just, all these good things that we do to take care of our bodies.
Absolutely.
And and you've also helped my husband. I've referred many friends to you for various health reasons, and they are all, the ones who have come to you have said, it's just a life changer. Your business name is the Ozark Herbalist, but we interchangeably use these names of herbalist, homeopathic, naturopathic, and holistic. So let's get that straight first.
The definitions. Okay. In the name itself, I wanted people, when they actually looked at the name, to know that we were alternative health. Okay? So if you look at the whole field that's out there between homeopathy and naturopathy and herbalism, people automatically know that an herb is alternative health.
Yes.
Okay? I could have named it energy medicine. I could have named it homeopathy. But people really didn't know where that came from. Okay? And we have progressed in our, assessments to be more functional, to be more frequency-based. So we have expanded beyond the herbalism, but that still sort of is our key thing that we do and to tie into. If we look at the definitions on our front, we have holistic. Okay, yes. What does holistic mean? Holistic means you involve the entire person. That means your spirit. That means your emotions, your mind, and the physical body. All right, so that's the definition of holistic. Okay, so a holistic healer can be a lot of different things with a lot of different spectrums. Okay, if we're looking at naturopathic was really where we started healing the body years ago. Okay, it wasn't really termed naturopathy until the late 1800s. When the term actually came around. And what does that mean? That means simply to heal the body naturally.
Okay.
All right. So what fits under that? A lot of different things fit under naturopath. Okay. Now you have to be careful in the definition of a naturopath because since about 1910, we really haven't had bona fide what we would consider naturopaths, okay, until recently. And there have been schools, College of Natural Medicine. And if you go there, it literally is like becoming a doctor of naturopath. Okay. But that is more mainline medicine where you're looking at the difference between an MD, a DO, and an ND. There's very little difference in what they actually do Because they all prescribe medications. They all prescribe, tests. They all do x-rays. So that particular definition is really becoming a little bit more tight in certain states. Now, in the state we are in Missouri, they do not recognize a naturopath as a physician.
So that is
period.
So that is by state.
That is by state.
I did not realize that.
Right.
Okay.
So in the state of Missouri, I am not considered a licensed healthcare practitioner because Missouri doesn't recognize naturopaths. Okay. And that is fine with me because I'm not under the auspices of their insurance and the AMA and what I have to do for my patients.
Right.
Okay.
So you can do what you believe works to heal your patients.
Absolutely. Okay. But there is a very fine line in a legal system. I cannot promote myself as a diagnosing, treating physician.
Okay.
That is restricted for medical doctors, DOs, and traditional healthcare medicine.
Okay.
Okay.
Yep.
If we look at what the naturopath actually does, and again, that involves a lot of different layers of what a natural healing can be. But we look at the diet, we look at the exercise, we look at, are you getting enough water? Are you getting sun? Are you getting rest? So we use the basic environment to say, how is your lifestyle? What can we do to heal it?
Okay.
Okay. Now we take that a step farther, and if we look at herbs have been around since the Paleolithic era?
Yeah.
I mean, literally 60,000 years. So we have a long history of herbs. When herbs came along, we know that there is a very, very good history of probably 16 to 20 herbs that are out there they have history that's better than the drugs that are out there.
Yeah.
Okay. But you cannot upregulate somebody with herbs if they don't have a good diet. So then that's what led me into nutrition, because the diet has to be good before you can upregulate with herbs what's wrong.
Right.
Okay.
Yeah, I understand that, because it won't make any difference if the rest of their lifestyle is doing them harm. You can't just introduce one herb.
You can't catch up with it.
Okay.
Okay. They have got to be willing to live a healthy lifestyle.
Yeah.
Okay. Then when we get into, I also use nutraceuticals. Nutraceuticals are simply products that are made from natural sources. So we're talking about vitamins, we're talking about amino acids, we're talking about minerals, all those different things that we give you to help support the body to balance it. Okay. Now when we get into homeopathy, that's a little bit different, because homeopathy is actually a form of medicine that have been practiced since the late 1700s. And this is a situation where you are really looking at using energies to balance the body. So you are using the body's innate ability to take these energies that come from natural products to tell the body where that balance is.
Okay.
So when somebody says, I'm taking a homeopathic, that has to be a dilution of a plant or an animal or sometimes bacteria, depending upon what we are looking at balancing in the body. Okay? There is a whole science behind homeopathy. And homeopathic doctors were the rule of thumb until about the 1910, when a gentleman by the name of Carnegie, depending upon what part of the country you're from, started this foundation to really look and see how valid that medicine was. And he changed our whole healthcare structure to the current pharmaceutical, insurance, AMA, etc.
Okay.
But homeopathy was there far before that. And we have a booklet, a reference booklet of all these different products and how they react in the body.
Okay.
But that's considered homeopathy.
Okay.
Okay. What else do we have left? Energy medicine. Energy medicine is another type of, again, naturopathic therapy. And energy medicine is really looking at the body from the energy it produces. We know that there are over 500,000 frequencies in the body. And if we know what those...
There's 500,000 frequencies in my body now.
Yeah, more than that. Those are the ones that have been identified. And we can actually measure those frequencies. And if those frequencies are deficient, or if they're over what they should be, they can cause imbalances in the body.
Okay.
And that's what we look to balance.
Okay.
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 So if you look at naturopathic, that can include a variety of different therapies. And that includes the body work, the massage, acupuncture, Chinese medicine, Ayurvedic medicine. So anything that's not mainstream allopathic medicine is considered naturopathic medicine. Okay? The way that it is divided as far as government and definitions, allopathic medicine is our traditional medicine. We have MDs, DOs, chiropractors can fit into that, but they can literally diagnose and treat a disease process.
Okay.
Okay?
Yep.
I do not diagnose. I do not treat. I evaluate and balance.
Okay.
Okay? I don't care what they have diagnosed you with. It has a core function imbalance. And that's what I look for.
Okay. That makes sense to me. And it's just like I said before, the reason I thank you for that was very clear for a very complicated question.
That was just question number one.
That was just question number one.
Yeah.
But it's true, as I said, we toss these terms around and we think they're all the same thing, and they're really very clearly not.
Right.
And so that was very, very helpful. Okay, so what was it that aimed you in the direction, instead of going, I don't know if I can say the word, how did you say that?
Allopathic.
Allopathic.
Yeah.
Instead of taking the allopathic route, what turned you to take am I right to say the herbalistic route?
Right.
Okay.
Most people that get into alternative medicine, and what I do is more integrative. It's not really alternative.
Right.
Alternative is like where you just reject the whole traditional medicine route. All right. No, I don't do that. I spent too much time in traditional medicine. I know that there's value there. Okay.
Yes.
So I do an integrative approach.
Okay.
I will not take you off your prescriptions. I will work with your doctor in getting your body optimized.
Yes.
Okay. Now I forgot the question.
Oh, well, what got you aimed in that direction since you had a background?
All right. Everybody usually has an epiphany that works in alternative medicine or naturopathic medicine.
Okay.
Mine happened to be, I was diagnosed with this mystic disease called fibromyalgia.
Oh, yes.
Okay. And that is a bucket term for the most part because they don't know what else to call it. You've got aches and pains, you don't feel good, you don't sleep well, and we're going to give you all these different pills and we're going to see what sort of helps your body deal with this, but they really don't know what causes it. Okay. Right? Mm-hmm. That's one of the things that we do is we find out what's causing your fibromyalgia. Well, I went the traditional route for 12 years. And I'm not going to give you my age, all right? But I went the traditional route for 12 years. I went through all the typical drug regimen, take this for this. Oh, now you've got a complication, take this for that. And by the time you got done, we were on 5 or 6 medications. It was affecting my gallbladder, affecting my liver. I ended up having surgery because of all these drugs, and it still hadn't relieved my pain.
Yeah.
So I went back to my internist, and I don't blame them because this is the way they're trained, right?
This is what they knew.
But I went back to them and I said, I am still hurting. What do I do? And she said, well, the only thing that we have left is we can try some opioids. Well, my brain goes bye-bye when I take a drug for pain. So I knew at that time that I needed to figure out what was wrong in the body. So after a lot of research, I bought a piece of equipment that literally scanned my body, okay? And I found out that I had Epstein-Barr virus.
Oh.
And I was extremely low in magnesium. And I know that if you talk to anybody who is in this naturopathic alternative realm, magnesium is one of those things that we just do not get enough of.
Yeah.
So I started literally filling my body with magnesium. And then to get rid of the Epstein-Barr virus, I used homeopathics.
Okay.
Okay. And over about a 3-month period, I was able to get off all my drug regimen and go back to riding my horses like I normally did. So I'm like, okay, so if I had this issue and I feel so much better than what I used to, I'm sure other people out there have got the same issues.
Yeah.
Okay. So that's when we, years ago, opened Ozark Herbalist. And we've grown from there. We've moved locations. We're gotten more into energy medicine because years ago, I did all the labs just like anybody else did.
Yeah.
Until I figured out the energy medicine, the frequency response.
Okay. So so you already had some medical education when you went through this yourself?
Oh, absolutely.
Yes. So you really specifically knew what you were looking for in a way that an average person would not.
18 years as a critical care nurse and instructor.
Yeah.
And then I had 18 years working for Abbott Laboratories, which is interesting. Okay, big pharma.
Yeah.
But I worked for the hospital products division, which is now no longer in existence, but I worked for that for 18 years. So I actually have quite a bit of Western medicine background.
Yes. Well, I knew that part, but I never knew that you had your own personal health issues to go into this. So, and that makes it so much more interesting because I think that is, it kind of gets into one of my questions that I had later, but when people say, you know, well, that's only, I have all these, like you said, people will come to me and they will say, well, that's really good that you see that doctor for small problems, but I have real problems like fibromyalgia or something along those lines. And then they'll start going on talking about, just like you said, I took this medicine and now I have this side effect. And so now I'm taking another one and then I have this side effect. And I think there's so many doctor's visits. You're missing out on your life. How do you address that to people? Because I'm sure just in normal conversations out in the public, people say comments like that to you.
Right. People have to be willing to change their lifestyle.
Okay. Yeah.
Because the world that we're in right now, we're in a drive-through era. Okay, even more so now because of the COVID. But people want instant relief. They don't want to have to work at it. And sometimes you have to back up and go, maybe it's what I'm eating that's not getting me to optimal health.
Yeah.
Okay. They have to believe that there is something that they can do to make their life better.
So that's a really good point, because I do think that the people who say, well, I'm on these medications and I have go to the doctor and all of this every single month, or go into hospital visits and had surgeries for things, most of them do just feel like there's nothing I can do.
Right. And
like where they told you the only resort is opioids.
They become their diagnosis.
Yeah.
So if you're ready to give up your diagnosis and get healthier, there's things that we can do to help with that. Now, depending upon how long the bridge has been out, might determine how much we can get back. It may not be a 4-lane bridge. It may be a 1-lane bridge. but we can definitely find the underlying imbalances because the pharmaceuticals do not treat underlying balance. Okay, we go in and look at what's imbalanced. Let's fix the imbalances. Let's not give a pharmaceutical just to relieve the symptoms, because the symptoms are not going to go away unless you fix the problem.
Yeah, that's what that's what I keep coming back to when people say, well, I take this host of medicines, and I think, okay, and it's just giving you more symptoms.
Right.
It's not relieving the problem.
Right, but they have to be willing. And the way I tell people is 80% of your healing is what you do, not what I do. It's what you do. Yeah. It is your diet. It is your lifestyle. It's your exercise program. It's getting out in the sun. It's having a good attitude. It's wanting to get better, not take a pill. Yeah. It's not a contest to see how many pills you can take versus your neighbor.
Yeah. Yeah. Yeah.
Interesting.
Yeah.
But I don't take anybody off medications. If they get, to be good enough that when they go to their doctor, they no longer need that, then that's the doctor's responsibility to take them off that medication.
Okay. Because that was one of my questions. Some people will say, well, that's like people did say to me, they say, well, that's good that you went for, getting through menopause or allergies or things like this. But I have this bigger problem. I have a deeper, more serious ailment. And so I did want to point out, because you have told me that before, that you work with the doctors.
Absolutely.
When people have, whether or not they have arthritis, cancer, like you said, any of these other things, if they are taking a medication, you'll work with them with what they're comfortable doing in addition to that, and then they have to have their doctor remove them from those medications.
That's correct.
Okay.
So what I do, if they're one of these that have a lot of things going on in the body, right? The bridge, all it is a walkway to go across right now. Okay. We have to literally backtrack, build up the whole system, and then they may never get off of all the drugs.
Yeah.
But we can get them healthier.
Yeah.
And that's what's important. But they have to be willing to put the time and effort behind it. I can be the coach, but I don't execute. They have to execute.
Yeah. They're the ones living their life each day, deciding, okay, I'm going to have a soda or I'm going to have water.
Right.
If I'm, certain foods I'm not supposed to eat because they'll interrupt my gut function, then it's their choice if they eat it or don't eat it.
Right.
Yeah.
Right.
Okay. So I thought of this as you were saying just a few minutes ago. It made me think of how I kind of got involved was, a lot of people know many, many years ago, I had a son who had cancer, and the oncologist at the time, the pediatric oncologist said, so this would have been in the very early 90s, and gave us a list of ingredients in foods that he could not have. Even though he was being fed by a G-tube, there were certain things they said, we're not sure if this, not that they couldn't say caused the cancer, but that it would, bring, I don't remember exactly how they worded that. They were very careful to say, we don't know that it causes cancer, but we do believe that it can inflame it or aggravate it or things like that. So first of all, very, very long ago, it was aspartame. No one thought anything of that, but this doctor said you can't have no diet soda, he was supposed to have yogurt, but they said don't get one that has aspartame in it. And they had this whole list of things that he couldn't have. And we put food in a blender, and then that went into his gut. And but they said like yellow dye number 5, I can't remember, but I had this whole list. And so what happened basically is I go home, I open up my kitchen cupboards and I start reading the ingredients boxes, and I just think, well, whatever has that ingredient in it, if he can't have it, I shouldn't have it. And we just start putting it in it ended, I was old Mother Hubbard with a bare cupboard. That I tell that all the time. And that's when we started switching to, whole foods, organic foods, just natural foods. That's when we completely changed our diet. And again, people will say that was radical, but I didn't think of it as radical at the time when you're thinking about, well, I'm saving my son's life, and if it harms him, it's probably going to harm me if we're just dealing with cancer. And I was fortunate. I lived in Minneapolis, and then we were in Colorado, and they all were very healthy eaters back then. So it was a lot easier to find true Greek yogurt and organic foods and all those things. And so that's what got me started on that kind of path because immediately, as I said, our headaches went away, our joint pain went away. Even though we were young, we noticed we had more energy, we felt great, and I thought, boy, there might be a little something.
Must be something to
this.
Yeah.
Well, and then I was introduced, and I do believe Dr. Hoover was referred to himself as a naturopath, but when I started going through menopause, what happened was I went to a doctor, and because I was tired, and their first description, without running any tests, they simply said, well, you're probably premenopause, and so we are going to they wanted to put me on a mild antidepressant and then something to boost my thyroid activity because they figured it was low. And somewhere someone gave me a name of Dr. Hoover, and I went to him, and he said, well, let's check a few things out, very much like what you do. And he checked things out, and he said, well, first of all, surprisingly enough, your thyroid is actually overactive right now, and because your cortisol levels are overactive right now, and it's that's what's causing you to feel tired. And so that's what started on. If I would have tried the other route, I just watched so many of my friends go through all of these issues of weight gain and mood swings and all these, and really, I just had a few things that up front maybe took me 6 months to take 5 or 6 supplements, and then I was down to 2 or 3, and I had none of those issues that so many of my friends had. And just one day, gradually, about 2 years later, I just stopped having a menstrual cycle, and it was that simple.
Yeah. And menopause is not a disease.
No,
it's a natural process.
Thank you for saying that.
Yeah, we go from the reproductive zone to the wise woman zone.
Yes, there we go.
Okay. It shouldn't be a diagnosable disease, okay?
No, yeah. And then there's so many side effects from all the different things that they were taking for their thyroid medication, and I thought, boy, they just had me take a little bit of iodine, and I did all right. Then he retired and moved away, and that's how I found you. And but I wanted to talk about 2 things about my case, because I thought this is an easy way to explain it to people, I think. Okay, so I found you. We did work on my cortisol and my thyroid levels, but also a couple that were very interesting to me was when I had the Rocky Mountain spotted fever, because I came to you just as one of my regular checkups, but then you started asking me some questions. You said, have you felt tired and out of breath easily lately? And I said, yeah, I just went downstairs and came back up the stairs, and I was absolutely exhausted. And then you said, have you had muscle fatigue? And I said, oh my gosh, yes. And I said, you're going down this list. And then you said, well, you, my dear, have Rocky Mountain spotted fever. And I said, what? So the other thing about that was, so you were able to tell me something that I just thought was, well, I'm just not getting old and tired, but I just wasn't putting together that I may have actually had something. Process. Yeah, I just thought, well, I'm just gradually aging. But you also said, rather than giving some antibiotic, we were going to build up my immune system. And that worked fabulously. So can you explain that a little bit, as how you were able to tell that is what I had, and why build up the immune system rather than take this one shot antibiotic or whatever it would have been that was only good for in a 2-week period or something like that, if you can.
Okay. When we look at, and tick diseases are a whole different lot.
Yeah.
I mean, if you live in Missouri, I'm sure that you've got, that country western song, pick ticks, But we do have a lot of just tick diseases that
Yeah.
are underlying a lot of systems.
Yes.
Okay? But rickettsia, which is the Rocky Mountain spotted fever, we used to think that ticks were all isolated in certain areas. No, because we are so mobile from one side of the United States to the other that really doesn't apply anymore.
Okay.
So when we pick up the energy, and every bacteria, every virus, every parasite has specific frequencies. So if we scan those frequencies, we can literally find, and when you come in and we do these routine scans, I look for anything that might be a hiccup in the system. And that happened to be something that sort of reared up and said hello to me. And I'm like, okay, are you having any of the symptoms that would go along with this? And you did. So what we did was activate the immune system. And how do you do that? An easy way to sort of think about the way homeopathics work is that we're giving your immune system a template of what to go find and destroy.
Okay.
So we're saying, okay, you see this bad guy here? All right, I want you to go look in the closets, under the bed. I want you to go in the liver and the heart and the muscles and the pancreas and the gut. And if you find this guy, get rid of him. And your immune system was really good.
Yeah.
So all we had to do was just put this template in and say, go get him. And you did exactly that.
Yeah.
Okay? But that was because your immune system was good, because what had you been doing? Eating well,
Yeah.
drinking water, exercising, getting in the sun, good mental attitude. That all affects the immune system. But if your immune system is strong, that's the reason we can fight the toxins and the bacteria and the viruses and the parasites and all the nasty stuff that's in our prepared foods and American diet.
Yeah, and I will say that, so I come in, the first time I came in, was it a radio frequency what was the first test that you do where I think I had on headphones?
Yeah, that's the AO scan.
Okay. And what does that do?
Okay, the AO scan, this is a company that was actually, the software was actually invented and perfected in Russia. And what it is for is to detect frequencies actually we do 24 pages of information.
Yeah, it was amazing.
Right. And we are simply looking at the frequencies that tell me what's going on in the body. So rather than doing urinalysis, rather than sending off stool samples, rather than doing skin scrapings or saliva or hair, it is all in, or blood.
Yeah.
It's all in this frequency test that we did. And of course, I'm from Missouri, so when we first got this, I had people bring in their lab work. And let's compare it and let's see if this is really accurate. And it was right on.
Oh, yeah.
So I'm like, that's what we do in order for me to get a baseline. That takes the place of all the labs I used to do, which would cost you a lot of money.
Yeah.
And then the results would trickle in.
Yeah.
And I wanted a snapshot of what's going on in the body today.
Yes.
And that's what it does.
And that's what I remember, like when you're saying my immune system was strong by the time I had the rickettsias, because I had been following everything you said to me. These are foods that will, kind of not be so great for you, or you won't react to so well, and these are going to be your best ones. And I followed all of that. You also took a scan of my eye. And I was amazed what you could find by looking through my eye.
Right, and that's called Iridology. And we actually have a certified iridologist here, Michelle Crane. And because this gives me a right now on time snapshot of frequencies, Iridology will give us a lot of history in the eyes. So she has been trained to take photographs of the eyes and to analyze them, and then we use that as a input for what type of food plan will work best in your body.
Yeah, I was just absolutely amazed at what you could tell by that. Okay, and then Another one was my mold allergy, because I think for so many years I have been one of those people, if you're allergic to mold or trees or those seasonal allergies. But I tried everything, the Claritin, the Zyrtec. I tried everything, and my eyes still watered like crazy, and I was just absolutely miserable. And you gave me some drops, and within 3 days, all of that was gone, and I only had to take those for 3 or 4 months, and then everything was cleared up. So how does that work? I guess for the listening audience, I think they wonder, why is that so different than taking one of the over-the-counter allergy medications?
If you're taking a pharmaceutical, it is going to suppress the body's reaction. And when that pharmaceutical wears off, the reaction is still there. You've just suppressed it.
Okay.
All right? Homeopathics are different because we literally tell the body, this is part of your environment. Why are you acting that way?
Okay.
Okay?
Yeah.
So we literally desensitize the body to the allergens. So if you've ever had allergy shots, you start out very small and then you build up to literally tell your body, don't react to that stuff. It's fine.
It's okay.
It's okay.
Yeah.
All right. So if we tell the body, this is just little micro units of this, you don't have to react to it. And then the body goes, okay, well, it's not going to kill me. So fine. It can be there.
Okay.
Okay.
Yeah. See, and I never realized that's really how that worked. I just knew, wow, I feel so much better. And it did. It's like you said, the others, you could take a pill in the morning, but when I'd go to bed at night, I had to either take another one or I still felt miserable.
Right.
And this, it was like once I started on it, and then you told me, finish out this, and I think it went for 2 or 3 months. And I just put the drops in my coffee, is what I remember. I just put the drops in my coffee every morning.
Yeah, that's fine.
Yeah, and then you said, well, if you're feeling better now, then you don't need to take it anymore. But if you're still having a reaction, let me know, and we'll just go another round.
Right, because we're looking at the frequencies that are imbalanced in the body. And we can tell that when we do the scan, what the body is reacting to. And it depends on whether we need to upgrade that reaction or calm down that reaction. Whether we use the herbs or the nutraceuticals or the homeopathics.
So, and we knew I was introduced to an environment that had a lot more mold than I was used to. This was when I had started working at Target, and the boxes had mold in the whole area,
Right.
So, so would it make sense also with seasonal that you would feel better during that like my tree allergens, allergic to the tree, during certain seasons that would come back?
It's possible, but a lot of times the more you use homeopathics, the less your body reacts to the toxin.
Okay. And then the other one was my muscle. I did feel some muscle fatigue, but was that just related to my rickettsia? Okay, because I was going to say, I really don't feel that anymore, but I didn't know. Okay. So, and I didn't want to completely skip over, because there are, in my listening audience, there's going to be so many women that do deal with menopause and the onset of that. So what is just a simple guideline that you can say you start off with that?
Okay. If you're having difficulty in menopause, look at your stress levels.
Yes. Because I guess my cortisol levels were just off the charts.
You have to be able to balance the hormones in the body, starting with the basics. And the basics are your pituitary, your hypothalamus, your adrenals, and the thyroid.
Okay.
And if your adrenals are off, there is a cascade that will affect the sex hormones, which are your estrogens, your testosterone, and of course your progesterone.
Okay.
But what the practice here, I see so many women with menopause issues that are driven by stress.
Yeah.
And of all the years that we've had to, I think everybody's under stress right now. So the menopause thing can really not have to be a disease process, but stress really enters into that.
Mm-hmm. Yeah. And you don't have a magic pill that takes away stress.
No. I do have things that we can help with that. But then, it goes back to the old rule of thumb again. What do we have to do? We have to eat well, think well, be well.
Get the right amount of sleep.
Absolutely.
I did have a friend who recently and they were complaining about migraines. And as you know, and I half jokingly but half seriously, I said, well, you do realize that you do 3 things that promote the migraines: is smoking heavily or vaping instead of smoking, large amounts of caffeine and sugar with energy drinks, and then a terrible sleep routine. There is no sleep routine. And I said, right there, that's just not helping the situation.
And that's a recipe for inflammation.
Yeah.
And inflammation breaks down everything.
Yeah. Yeah. That is the other thing I've learned from you. We have been so much better about, like you said, just even certain foods that we eat and don't eat, and the inflammation process. And then I think, gosh, this is just, it's such a simple fix. You do have to change your eating habits or your, certain things about your lifestyle, but boy, is that such a simpler fix. Okay. So I also wanted to get into an overview of this diagnostic and I'm looking at it right now. I put my hand on this little metal plate here, and then it reads everything. Did you
I have a program that I utilize through Zyto. It's called Zyto, and I have what they call the Elite 5. And the hand cradle is really no different than the headsets.
Okay.
It's just, and you could stand on it rather than put your hand on it. As long as I can ask the body energy questions and get answers back, we can do it with a headset. We can do it with a probe. We can do it with the hand cradle. Yeah. So all we do is ask energy questions. And the body comes back and tells me if it's deficient or overdosed or balanced.
Okay. And then you can also key in, am I correct? You key it in and you say, okay, if we treated it with this, and then it gives you a reading, because I'm remembering the dots, and then it tells you, okay, this would be beneficial, or no, this isn't going to do much.
Right. It's sort of like doing a dry run. It's sort of like giving you all the frequencies in combination, because if you give anything that's natural with something else that's natural, it potentiates the work of those supplements.
Yes.
Okay. So what we do is sort of a trial run. We give you the frequencies of the supplements or the herbs, the nutraceuticals, the homeopathics that we're going to use, and I look at your body's reaction. And I want a very positive reaction. I want you to spend your money for what works.
Yeah. I think that's when people talk about the price of things, or if things are covered by insurance or not. And I think, wow, I have 2 or 3 things that I take every day, and then something that a thyroid iodine. I take iodine 3 times a week. And I think, wow, I am not spending very much money and I feel great and it works. Rather than if like the over-the-counter allergy medicine. I was I was spending all kinds of money on that and it wasn't working. Right. My eyes were still watering. I was still miserable. Just out of curiosity, it just occurred to me, I do hear a lot of people, because I do take, and I'm not even sure which ones I take. I take a B12 of some kind and something. So, no, that I mean that you give me. So isn't that a very common issue that people are not getting the proper B12s? Like when they try to I guess what I'm getting at is people will ask me, what do you take? Do you take B12? Do you take B6? What do you take? And then they're just going to go to the store and find a generic version at the vitamin store. And they think, if I take what she takes, then I'll be better. And it doesn't work that way.
Right. Right.
Yeah. So
supplements are like cars. Are there different kinds?
okay. Yeah.
I'd just as soon have a Lamborghini.
Yeah.
But, some people are driving around Pintos. So you have to think about supplements as being as good as the person that recommended them.
Okay.
Because you've got to know what's in it. And B12 is a classic example because most B12 is cyanocobalamin.
Well, what does that mean?
It is B12 that's attached to a cyanide molecule.
Oh.
Yuck.
That sounds very dangerous, actually.
But that's what's in most of your multivitamins is the cyanocobalamin because it's very cheap to make. That's what they put in B vitamin, in a lot of your B vitamins and B complexes.
And so that's why they're so cheap, and that's why they're not effective.
Yeah.
And because different people need different levels.
Right.
Yeah.
And we find if you study anything with anti-aging, we know that about age 50, a lot of our metabolic processes don't work as well. The extraction isn't as good. The digestive enzymes aren't as good. So as part of this anti-aging thing, one of the things that you can do is take really good B12, combine it with folate, not folic, but folate, and that helps brain, nerves, general cellular energy. Mm-hmm. Okay, so I'm very picky about the B12s that we do and how much we do.
Yes. Yeah, and I realized that too, because even Larry said, well, I'll just take what you're taking. And I said, no, you're going to go have an appointment and they will tell you what's right for your body because I'm sure you're not the same as me.
Right, it's not one size fits all.
No. And, that was one thing that I do remember that had happened right before I came to you. I was in between, and I had a friend who, and I don't want to give a bad reputation for the company, but she was, was one of those multivitamins, and it was kind of, you take this and you're going to feel fabulous. And I took it, and I had every side effect that I felt miserable within 2 weeks. Mm-hmm. And I came to you, and I remember you said, well, because it's not at all right for your body. Different for some people, if they've taken nothing and they've lived this horrible lifestyle, they take something and they may feel better. But for me, it crashed. The B12s were the exact opposite of what I needed, or something, or I wasn't absorbing it, or something. Yeah, and it didn't work for me at all. Mm-hmm. And you said, well, let's just try this. And I felt so much better in the first week.
Right. And multivitamins, for the most part, and even the multi-level things, they're not a bad thing typically, but they don't have enough to really be therapeutic. Yeah. It's a touch here, a touch here, a touch here. If you eat poorly and you get on some of this stuff that is guaranteed to give you energy, guess what? It probably will.
Yeah.
But why are you subbing that and the cost of that product for just eating well?
Yeah. Yeah. Just eat these foods and they will help. Yeah. Well, that balanced it out for me so much better. So we've really covered we did. We covered all of the questions that I had for you. Is there something that I didn't ask you that you want to be sure as a message with your medicine or how you care for people? Is there a message that you want to be sure to get out there to people that you come across in your office all the time of people not doing things to take care of themselves, or misconceptions?
Most of the misconceptions is that there's going to be a magic pill. That they come to me, there's going to be a magic pill that's going to replace what they're doing to make them feel better. And again, it goes back to what we talked about at the beginning. You have to put the work into it. Mm-hmm. And people ask me, are there ever people that come in and have really good scans? I'm like, yeah, they're herbalists, they're vegans, and they live off the land.
Yeah.
I personally don't want to live off the land. It's too much work.
Yeah.
Okay. So you have to be very, if you don't pay for your health now, you will pay for your health later. Yeah. And it's much, much better and much more enjoyable to enjoy good food now as to worry about it down the road.
Yeah. Yeah.
Okay.
That's where I think it did make a difference that I was in my late 20s, early 30s when we went through that with Ellis, because it did drastically change my eating habits, and I wouldn't have done that if they hadn't said don't take any of these things. And
right.
right.
And we know that inflammation is the key to a lot of bad things that happen to us. Okay, including the C word. Okay, cardiovascular disease, cancers, all these things that are chronic diseases. We know that the key to that is inflammation.
Yeah.
How do we control inflammation? By what we put in our body, by what we get, on our environment, what we are exposed to.
Yeah.
Okay. So I would say that we do see chronic deficiencies here that we address, but most of it you will get out of what you put in.
Yeah.
Okay. I'm the coach, but you have to execute.
Yeah.
And I will be here to help you get healthy. But you've got to be willing to put the time in.
Yeah. Yeah. So like you said, it's not just the supplements that you are giving me. I have to do all these other things at home, or they're only going to help so much.
Right.
Yeah. So what do you love most about the work that you do in helping people? What do you love the most about it?
I like people coming in and telling me that they feel better than they have in a long time.
Yeah.
Or they can pick up their grandson because their muscles don't hurt anymore. Or they can enjoy foods again. Or they're off of certain medications that really, from an emotional standpoint, had them numb to the world.
Yeah. Yeah. I do remember Larry was having really liver issues because he was taking an Advil or an Aleve every single day, and because of the inflammation and not doing that anymore, and doing much better.
I love to see people. I love to be able to coach people and have them come back in and have the plan work.
Yeah. Yeah.
And then I only need to see them every 6 months or a year.
Yes.
Or if there's something wrong, let me know.
Yes.
But once we get you balanced and you feel that balance, you don't want to lose it.
Yeah. Yeah. Well, and that's why I just, I want to close with saying thank you for doing that for me. And because that's why I can so easily recommend you to so many people, is because they say, gosh, your eyes are always so bright and clear and you seem happy and energy. And, so many people say they don't realize my age, and it's not just, oh, you have good skin. It's because I do feel so good. And so I really appreciate that. And I do come in. I think I probably do now.
That's okay. It's been a weird year. COVID's been weird. Okay.
But basically at first I came in, I think it was once every 3 weeks for like a month or two, couple months actually. And then after that, it just became just check back in every 6 months. And that's what I do. Right. And I just thank you so much for taking care of me. And I thank you so much for also my husband, because then we will have more time together. And we will be sure to for our listeners, we will have links to your site so that people can get in touch with you. Okay. So thank you.
We appreciate that. We appreciate you too, dear.
Oh, thank you so much.
God bless you.
Thanks. Now you have met my doctor and learned more than you expected about my health. We covered a lot of information that may lead to more questions, so know that you can find links to the Ozark Herbalist in today's show notes. Please share this episode with a friend or family who needs to improve their energy levels. And take care out there. Thank you for listening to us today, and continue to listen to each other.